Hello everyone. Today we'll be discussing on the topic classification of disability, particularly focusing on behavioral disorders, adjustment problems, emotional problems, and personality disorders. To start with, we will introduce the topic. Disability, as we know, is an umbrella term covering impairments, activity limitations, and participation restrictions. An impairment is a problem in a body, function, or structure. An activity limitation is a difficulty encountered by an individual in executing a task or action, while a participation restriction is a problem experienced by an individual in involvement in life situations. Disability is a consequence of an impairment that may be physical, cognitive, mental, sensory, emotional, developmental, or some combination of these. A disability may be present from birth or occur during a person's lifetime. The conditions causing disability are classified by the medical community as first, inherited, that is genetically transmitted. Second, congenital, meaning caused by a mother's infection or other disease during pregnancy, embryonic or fetal development irregularities, or by injury during or soon after birth. And the third condition is acquired, such as conditions caused by illness or injury, while some are of unknown origin. On the basis of the above mentioned conditions, disabilities can be classified into the following types: physical disability, sensory disability, vision impairment, hearing impairment, olfactory and gustatory impairment, somatosensory impairment, balance disorder, intellectual disability, mental or emotional disabilities, pervasive developmental disorders, developmental disability, non-visible disabilities, behavioral disorders, adjustment problems, personality disorders, etc. First, we'll be discussing about behavioral disorders. Behavioral disorder, which is also referred to as mental and emotional disorder, can be caused by any of the causes that have been mentioned previously in the introduction of the text. Behavior is an outcome of an individual's encounter with the individuals or environment that is present around him. If a student demonstrates behaviors listed under the definition of Individuals with Disabilities Education Act, which will be discussed in detail under the section Emotional Problems, they may be considered to have a behavioral disorder. A psychologist or behavior specialist is most likely to be able to provide an appropriate diagnosis for an individual based on observations, checklists, and behavior documentation. Characteristics which identify an individual as having a behavior disorders are demonstrated in a variety of settings, with little consideration or understanding of social or cultural rules. An individual or child with behavioral disorders may display the following academic characteristics. He may disrupt in classroom activities. He may be impulsive. He might be inattentive or distractible. He might be preoccupied. The child does not follow or appear to care about classroom rules. He has poor concentration. There is a resistance to change and transitions in routines. Often speaks out with irrelevant information or without regard to turn-taking rules. He demonstrates aggressive behavior. He intimidates and bullies other students. He is regularly absent from school. He consistently blames others for their dishonesty, and he has a very low self-esteem as well. He has a difficulty working in groups. He demonstrates self-injurious behavior. He cannot apply social rules related to other personal space and belongings. He often manipulates the situations. The educational recommendations that can be followed are: teaching strategies for these students should be based on changing the behavior itself. The system is often centered or discouraging the unwanted behavior and rewarding and encouraging the desired behavior. Specifically, identify the behavior which needs to be changed. Create a baseline of the observed behavior. Closely examine the information in the baseline and evaluate what has been observed and documented. Develop short and long-term goals for the student. In the plan, create a reward system to be used, such as give the student a check mark for every 15 minutes behavior is appropriate. When the student receives 8 checks, they may have 10 minutes of computer time. Re-evaluate the plan for effectiveness. Has the behavior reduced occurrences in a variety of settings or not? Make modifications in the behavior plan to reinforce the desired outcome. A behavior modification chart is a widely accepted tool to help the child visually understand the key behavior expectations and track their progress. Next, we'll be discussing about the adjustment problems. An adjustment disorder or adjustment problem is also referred to as exogenous, reactive or situational depression. It is a disorder that occurs when an individual is unable to adjust or to cope with a particular stressor, like a major life event. Since people with this disorder normally have symptoms that depressed people do, such as general loss of interest, feelings of hopelessness and crying, this disorder is sometimes referred to as situational depression. Unlike major depression, the disorder is caused by an outside stressor and generally resolves once the individual is able to adapt to that situation. Common characteristics of adjustment disorder includes mild depressive symptoms, anxiety symptoms, and traumatic stress symptoms, or a combination of the three. There are 9 types of adjustment disorders listed in the Diagnostic of Statistical Manual for Mental Disorders. According to the Diagnostic Manual of Mental Disorders in the 4th edition, there are 6 types of adjustment disorders, which are characterized by the following predominant symptoms, ranging from depressed mood, anxiety, mixed depression and anxiety, disturbance of conduct, mixed disturbance of emotions and conduct, and unspecified. However, the criteria for these symptoms are not specified in greater detail. Adjustment disorder may be acute or chronic depending on whether it lasts more or less than 6 months. According to the DSM 4th edition, if the adjustment disorder lasts less than 6 months, then it may be considered acute. If it lasts more than 6 months, it may be considered as chronic. Moreover, the symptoms cannot last longer than 6 months after the stressor or stressors or its consequences have been terminated. Diagnosis of adjustment disorder is quite common. There is an estimated incidence of 5 to 21% among psychiatric consultation services for adults. Adult women are diagnosed twice as often as adult men. Among children and adolescents, girls and boys are equally likely to receive this diagnosis. Some emotional signs of adjustment disorders that are most commonly visible are sadness, hopelessness, lack of enjoyment, crying spells, nervousness, anxiety, worry, depression, trouble in sleeping, a difficulty in concentrating, and feeling overwhelmed and thoughts of suicide. Some of the behavioral signs of adjustment disorders are fighting, reckless driving, ignoring important tasks such as bills or homework, seeking approval from others by any way possible, that may be by cheating or lying or escaping the reality, avoiding family or friends, performing poorly in the schools, skipping schools, and vandalizing property. Suicidal behavior is prominent among people with adjustment disorders of all ages, and up to 1/5 of adolescent suicide victims may have had an adjustment disorder. The recommended treatment for adjustment disorder is psychotherapy. The goal of psychotherapy is symptom relief and behavior change. Anxiety may be presented as a signal from the body that something in the patient's life needs to change. Treatment allows the patient to put his or her distress or rage into words rather than into destructive actions. Individual therapy can help a person gain the support they need, identify abnormal responses, and maximize the use of individuals' strengths. Counseling, psychotherapy, crisis intervention, family therapy, behavioral therapy, and self-help group treatment are often used to encourage the verbalization of fears, anxiety, rage, helplessness, and hopelessness. Sometimes small doses of antidepressants and anxiolytics are used in addition to other forms of treatment. In addition to professional help, parents and caregivers can help their children with their difficulty adjusting by offering encouragement to talk about his or her emotions, offering support and understanding, reassuring the child that their reactions are normal, involving the child's teachers to check on their progress in school, letting the child make simple decisions at home such as what to eat for dinner or what show to watch on the television, having the child engage in a hobby or activity that they enjoy. Next, let us discuss about emotional problems. An emotional problem is associated to the mental disorder or mental illness. Mental disorder or mental illness is a psychological, behavioral or emotional pattern generally associated with subjective distress or disability that occurs in an individual and perceived by the majority of society as being outside of normal development or cultural expectations. The recognition and understanding of mental health conditions has changed over time and across cultures, and there are still variations in the definition, assessment, and classification of mental disorders, although standard guideline criteria are widely accepted. Many terms are used to describe emotional, behavioral, or mental disorders. Currently, students with such disorders are categorized as having an emotional disturbance, which is defined under the Individuals with Disabilities Education Act as follows: a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects the child's educational performances. The factors are an inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and their teachers, inappropriate types of behaviors or feelings under normal circumstances as well, a general pervasive mood of unhappiness or depression, a tendency to develop physical symptoms of fears associated with personal or school factors. As defined by the Individuals with Disability Education Act, emotional disturbance includes schizophrenia but does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. An emotional and behavior disorder is an emotional disability characterized by the following characteristics: an inability to build or maintain satisfactory interpersonal relationships with peers and or teachers. For preschool age children, this would include other care providers as well. An inability to learn which cannot be adequately explained by intellectual, sensory, or health factors again. Consistent or chronic inappropriate type of behavior or feelings under normal conditions. Displayed pervasive mood of unhappiness or depression. Displayed tendency to develop physical symptoms, pains, or unreasonable fears associated with personal or school problems. Next, we'll be discussing on the personality disorders existing among the group. Personality refers to characteristic traits, coping styles, and way of thinking and behaving or interacting in the social environment. These traits emerge during childhood and crystallize into established patterns by the end of adolescence or early adulthood. These patterns are traits and behavior that are unique to each and every individual. Personality disorders have been defined as an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. In the book on Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association, personality, defined psychologically, is the set of enduring behavioral and mental traits that distinguish human beings. Hence, personality disorders are defined by experiences and behaviors that differ from societal norms and expectations. Those diagnosed with personality disorders may experience difficulties in cognition, emotiveness, interpersonal functioning, or control of impulses. In general, personality disorders are diagnosed in 40 to 60% of psychiatric patients, making them the most frequent of all psychiatric diagnoses. When personality traits are inflexible and maladaptive and causes significant functional impairment or subjective distress, then they constitute personality disorder. This type of disorder affects almost all that a person is in contact with, be it his employment, his relationships, and even where one lives. However, the distress may not be very personal, as it is others who feel it. Let us now go to the classification of personality disorders. There are two major systems of classification of personality disorders: the International Statistical Classification of Diseases and Related Health Problems, also abbreviated as ICD, and the Diagnostic and Statistical Manual of Mental Disorders, abbreviated as DSM. Both the systems have deliberately merged their diagnosis to some extent, but some differences remain. For example, ICD-10 does not include narcissistic personality disorder as a distinct category, while DSM-5 does not include enduring personality change after catastrophic experience or after psychiatric illness. ICD-10 classifies the DSM-5 schizotypal personality disorder as a form of schizophrenia rather than as a personality disorder. There are accepted diagnostic issues and controversies with regard to distinguishing particular personality disorders categories from each other. First, let us discuss about the classification of International Statistical Classification of Diseases and Related Health Problems, ICD. It is related to the World Health Organization. The ICD-10 section on mental and behavior disorders includes categories of personality disorders and enduring personality changes. They are defined as ingrained patterns indicated by inflexible and disabling responses that significantly differ from how the average person in the culture perceives, thinks, and feels, particularly in relating to others. The specific personality disorders are paranoid, schizoid, dissocial, and emotionally unstable, that is also called borderline type and impulsive type, histrionic, anancastic, anxious, that is avoidant, and dependent. There is also an others category involving conditions characterized as eccentric, helpless, immature, narcissistic, passive-aggressive, or psychoneurotic. An additional category is for unspecified personality disorders, including character neurosis and pathological personality. There is also a category for mixed and other personality disorders, defined as conditions that are often troublesome but do not demonstrate the specific pattern of symptoms in the named disorders. Finally, there is a category of enduring personality changes not attributable to brain damage and disease. This is for conditions that seem to arise in adults without a diagnosis of personality disorder, following catastrophic or prolonged stress or other psychiatric illnesses. Next, we'll discuss about the classification given by the Diagnostic and Statistical Manual of Mental Disorders, that is DSM. The Diagnostic and Statistical Manual of Mental Disorders, currently the 5th edition, lists 10 personality disorders grouped into 3 clusters. The 5th edition of DSM also contains 3 diagnoses for personality patterns that do not match these 10 disorders, but nevertheless exhibit characteristics of a personality disorders. The clusters are: Cluster A, it consists of odd disorders. Cluster B, it consists of dramatic, emotional or erratic disorders. And Cluster C consists of anxious or fearful disorders. There is another categorization, the 3rd categorization, that is additional classification factors. It is possible to classify personality disorders using additional factors such as severity, the impact on social functioning and attribution as well. Let us now conclude the topic by saying that disability is not a disease in itself. It consists of such traits, factors or conditions that deviate an individual from his normal functioning. However, they can be identified and rectified with the help of experts and the love, care and affection from family and peer group. Thank you.